Good morning, everybody. This is G Hyatt, and I'm coming to you guys this morning instead of this afternoon because I have a full plate. But I wanted to make sure that I kept my word and came on so that I can give you all a mental health tip. But before I get started, I did want to take a moment and to thank Miss Kim Massengill-Satterwhite and her husband D, because they blessed the hell out of my family after last week's live mental health tip. When I tell you, God knows, just pray. That's all I can tell you is pray in the secret, because you never know who is going to bless you in the overflow. And I can't be more happy and grateful for the blessing that they bestowed upon me and my family. So thank you, Kim and Dee. Y'all the best mentors a person could ever have. Another thing that I wanted to tell you guys is that I came across a special deal yesterday on Amazon for people who have Medicaid and or EBT and wanted to be Amazon Prime members, where you can get stuff shipped to you guys for free, discounted deals and different things like that. Hit me up and I can send you a link so you can find out more about that. That is a steal, $5.99 a month. You definitely want to get your hands on that if you have EBT and or Medicaid or know somebody who does. I'll shoot you the information. Now let me go ahead and get started with today's topic, which is the struggle is real. I am going to turn off comments and everything because I'm going to be uploading this into my blog. But then once I'm done, I'll shoot it back over to see if I have any questions for me or anything. Okay, so I was asked what makes me qualified to work with people or talk to somebody or help somebody that has a mental health disorder. And so I wanted to answer that question with this. I don't know if you can see this or not, but this is my certification. I have to recertify every 2 years. I am a certified peer support specialist for the state of North Carolina. Which means that I have demonstrated at least a year of lived experience and or sobriety. Now, let me explain that. Recovery. At least a year of successful recovery. Now, does that mean that I'm not going to fall off from time to time? No. Does that mean that I don't have symptoms from time to time? No. But it means that I've learned how to manage them in a way where I can show other people how to manage their symptoms and or assist them in their recovery efforts as far as getting sober off alcohol or drugs. Also, I have gone a little bit further and I also have a facilitator license. So not only am I certified as a peer support specialist, I also am an instructor. So besides the credentials, I do have the lived experience, being that I was diagnosed in 2003, and I still have my ups and downs with symptoms. Even currently, as of Friday, I'm still going through stuff that I'm going to talk a little bit about here in just a few minutes. But the struggle is real when it comes to med management for a person, not only that has a mental illness, but also if we're duly diagnosed or have other health complications along the way. So for those of you guys who are caretakers, guardians, family members, loved ones of someone with mental illness, this can be quite a touchy subject for going both ways. And I wanted to tackle this subject today because it is a touchy subject. Everybody has a viewpoint on, give a person with mental illness medication. Person with mental illness, I don't want medication. It makes me feel funny. It's that yo-yo of, you got to take this so you can be back to your old self. Well, I don't want to take this because it doesn't make me feel like my old self. So I want to get into this subject because the struggle is real with this situation. Me and my mom, for years, when I was really, 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 really bad, man, it was back and forth because I was in and out of the hospital, because I would not take my medication. And for somebody who has a mental illness, you get what I'm talking about. The other part about it that they don't talk about with the medication is that a lot of times, more times than not, the medication make you feel worse than you felt prior to taking it, and then there's also other health complications that they don't tell you about. So for me, I'm kind of on the fence when it comes to med management, because I know there are other things you can do besides med management to get your condition with a mental illness stable. So like for myself, I'm duly diagnosed, so I also have I'm in recovery for alcoholism on top of having bipolar disorder type 1. So I have the mania, I have the racing thoughts, I have the sleeplessness, I have the, excessive, obsessive compulsive things that we do. I get fixated on things. I go through all of that stuff. So for me, when they were trying to give me stabilized, they tried a lot of different medications, medication to help me sleep, medication to help my moods more stabilized, medications to help the edginess, because I could get very volatile with it. But what happened was every time they gave me medication, it just like my blood pressure went up. I started having other problems that were medical. So what happened was they ended up giving me medication for that on top of the medication for the psych issues. And eventually they became a beautiful storm in my system, and I ended up with rhabdomyolysis. I can't say it right, but it's rhabdo for short. But the one thing that I didn't disclose was that I was drinking alcohol while I was taking medication, which is an absolute no-no. I'm not proud of that, but that's what, I was in knee deep in my stuff. So what happened was that I ended up in renal failure, kidney failure, and I almost lost my life behind that. So it was quite a journey, which is the reason why I have chronic pain and things, physically going on with me to this day. So after that situation happened, I was very, very crystal clear with my doctors about what I am willing to take and what I'm not willing to take because of the side effects. Now, as an adult, I have that choice to decide how I want to treat my illness, just like anybody with cancer, lupus, sickle cell, any multiple sclerosis, anything. You have a choice on how you want to treat the symptoms, how you want to treat your illness. Can't nobody tell you what you can and can't do. Now, of course, with everything, when you decide to not do this, of course, there could be consequences, but it's just like, what you willing to deal with? Because we're talking about your quality of life as well. And sometimes for caretakers, this can be, when you have to make decisions for your child, when you have to make decisions for somebody, you do have to weigh the options. Sometimes the medicine that they're offering you is causing more harm than good. So don't be so quick to be like shove medicine down somebody's throat, because it could cause more harm than good, especially for somebody like me that's bipolar. Okay, so what has helped me along the way is I did end up finding a medication that helps. However, like right now, I just had a baby. So what does that mean for me? I'm breastfeeding. I am a very big advocate on breastfeeding because of the benefits. I've nursed both of my my two daughters. I nursed them, and I'm nursing my son. So that means there are a lot of medications I cannot take because the stuff that they give me is heavy duty. So I'm not on medication right now, which is why I'm somewhat symptomatic right now. What is helping me is cognitive behavior therapy. I'm going to my therapist more. I'm using EAP through my job. I'm also communicating with my supervisor, talking with my mom, talking with my oldest daughter. Learning my triggers is a big key. When you know your triggers and the things that's going to set you off, then you have to do things to offset them, or preventive things and being proactive with it. That's what you learn in therapy. You don't learn it in taking medication. So I am, like, once I'm done breastfeeding, I do plan on getting back on medication. So it's not a long-term solution, it's a short-term solution, because I did find a good one that does help me focus, does, help me channel my moods a lot better, but I can't do that right now. So, for somebody that I'm working with, we sit down and we have an honest conversation, because the thing about it, peer to peer, like when somebody have lived experience talking to somebody that's going through it, they're going to be honest and say, you know, this is what I'm doing, this is how it makes me feel. And a lot of times if you don't sit down and listen to that person, you're going to constantly be at odds with them, especially if they're an adult. Now, if they're under 18 and you're the parent, you make the decision that's going to be best for you and your child. But once they turn 18, you better be more of a support and be more understanding, because what I teach my peers is how to advocate for themselves, because only they know the best way as far as their quality of life is concerned. Because one thing you have to understand is that once you're diagnosed with a mental illness, that's it. I mean, it's not like it's gonna ever go away. It can plateau, it can go into what they call a remission status, but that's it. It doesn't, you know, that's pretty much it. So I wanted to get on here to tell you the pros and cons of med management, my experience with it, especially, and it's more complicated when you're duly diagnosed. I tried self-medicating with marijuana. It did not work for me because I have hallucinations and delusions with it, so that was not the route to go for me. It made me worse than it did make me better. But for some people, it helps with the anxiety, you know. So for me, that didn't work. Alcohol worked, but then it didn't work because I overconsumed it. Because one thing about with a mental illness is that sometimes we can fixate and get compulsive on things, and we can take anything and run with it. May it be spending, may it be eating, controlling our weight, cleaning, or being messy because we want to keep everything. So it's a yo-yo, and I'm not gonna tell you loving us is easy. It is hard to love. It's hard to love me. I ain't gonna lie. I can be quite a lot. But you know what? Everybody's got some stuff. Everybody's got something they working with. You know, you can take somebody that don't have a diagnosis and they out here committing every felony in the world, and then the minute they get caught, they want to go call themselves a minister. I'm just saying. So, you know, we all got something that we're dealing with. So in conclusion, I just want to wrap this up and just say that, you know, the best solution for the med management is sitting down with a person and really relying on somebody that has lived experience to sit down and get real with them. Like me, I'm gonna keep it 100 with someone and tell them the benefits and the pros and the cons of taking your medication. Of course, it does get you stabilized if you get the right medication. But do you know how long it took for me to get there? It took me a long time, and my body went through a lot of stuff. So if somebody's very resistant because it's making them feel this kind of way, listen to them. Sit down with the doctor, explain the side effects of what's going on. Might need to be tapered off, may need to be taken down. But what you don't want to do is force somebody, because what you're going to end up seeing is a revolving door in and out the hospital. Or them self-medicating and them being shut down. Because one thing we are as adults, and we want to be heard. We want to have the same rights, even though we have a mental disability or challenge. We want the same rights as everybody else when it comes to their care and treatment plan. So think about yourself if you were in that person's shoes, and I hope to God that doesn't ever happen where you have to switch roles with this person that you are already caring for. But at the same time, if you walked a mile in that person's shoes, you would kind of understand where, you know, they're coming from. Don't look at them as your child. Don't look at them as your loved one. Look at them as a person that has something given to them that they didn't ask for, and now they're being asked to live a different way than what they're used to. Give them some grace. Be a support to them. Get them linked with resources, other people that you know that are going through it with them, so that they have somebody in their corner, because they're more willing and more open to be willing to look at options if they knew somebody else was in their corner. All right, I'm done. I am wrapping it up. If anybody have any questions or anything, please share this. Please, 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 please share this. Please share this. Please, please, please share this. I had almost 800 views yesterday. I mean, not yesterday. Last week, we had almost 800 views. 800 views. That means divide that by 3. That many people got blessed by that message, and they felt a whole lot better about their life, you know, and what they're going through. And that's what this is all about. This is about taking the shame away. This is about taking that stigma away. This is about having those uncomfortable conversations that need to be had, because guess what? We're going through it. And people need support. The people who are personally affected need support. The person who is caring for the person that's going through it needs support. We all need support in this. This is not a one-person battle. This is a family. This is a village. This is a community that's going through this. It's not just one person, and it ain't just the person that's affected. It affects everybody involved. So if you missed the message, go back, watch it. I'll be looking for any comments. I'll be responding. And I'll be back next Monday with another mental health tip. This is G. Hyatt. I am signing off. You all have a blessed day. Don't forget to share.